Hi, this is Dr. Ellis, and I'm going to be talking about flu and COVID vaccines for the season. We do recommend that all kids 6 months and up get their flu vaccine, and the parents too of the kids around them. We offer those to the parents too, if you guys would like to get them. As long as you're not on an HMO, we can bill your insurance for it. Also, you can schedule flu shots either by calling the office, or you can do it through the portal or the website as long as you're signed into the portal on Monday, Wednesdays, and Fridays, and some Saturdays, especially in October. If those times don't work for you, we have other nurse visits times, and you can call the office to schedule appointments. We usually like the kids all to be vaccinated before Halloween for the flu. Okay, you can get it later if you forgot to get it, but ideally you get it, before the flu season starts. And as far as COVID vaccine, this year we're going to have to give the Moderna vaccine to the little ones because the Pfizer is not available. There's no Pfizer available. The only one available for kids under 5 is Moderna. And since the Moderna one is from 6 to 11, we're going to go ahead and use that one for 6 to 11. And then the 12 and up can get Moderna or Pfizer depending on our availability. And we're going by the American Academy of Pediatrics recommendation, which is for sure all kids under 2 because they're usually naive to COVID. The maternal antibodies are gone. Maybe they haven't had COVID yet. And the vaccine protects them against getting the disease, passing it on to other people, and long COVID, and also decreases the risk for that multiple inflammatory syndrome that happens a few weeks after you get COVID. So we do recommend that, but I would recommend that everybody also get a booster that's a child, even if they don't have risk factors. But you can talk to your doctor about that if you want to know the pros and cons on that. We do recommend that if you want to have a discussion about that, just go ahead and make a telemed visit so you can talk about your particular situation. We are going to offer the vaccine, the COVID vaccine for parents, because we understand there's going to be some hurdles people have to go through in the pharmacy, and we want to make it available to anybody who would like to get it. And again, if you're on an HMO, you might have to pay out of pocket, but it might be worth it if you're having trouble getting it elsewhere. And we are not going to ask if you have a risk factor, because everybody probably has someone they're in contact with that has a risk factor, and you're supposed to get vaccinated for those people too. So don't worry about that as being a barrier at our office. And again, if you have any questions, you can call us or schedule a telemed visit. But I hope that you guys, trust us and know that we do feel like vaccines are very important in your kids' life and in your life, for your community. It all takes a community effort to keep everybody protected. Thanks.